Testing troubles in Charlotte. You know, we've been telling you for a while now, there are long lines at testing sites all across North Carolina. And it turns out that's flooding into our area emergency rooms. Medical workers describing packed waiting rooms as hundreds try to get tested. They say with so many patients who aren't in critical need coming in, this is having a direct effect on those who do need emergency help.
We're seeing the highest volume of patients that I've seen in my entire time being here at Novant. Even since the beginning of COVID surge, the patients that we're seeing are coming in for primarily COVID testing and really for COVID exposure. If you come into the emergency department and you want to be seen, we're going to see you. That's our duty. If you check in and be seen, we want to make sure you're medically stabilized, and then we will complete your COVID swab. But the good thing is that we have other options at Novant for patients outside of the emergency department.
And so as we talk about testing, let's go ahead and take a moment to take a closer look at our COVID numbers tonight. We are seeing some concern, but not all bad news as North Carolina releases its post-Christmas COVID metrics. As we can see here, cases are taking a sharper turn upwards. You could see that average moving upwards, this average line. Average daily cases are actually up about 32% from this time last week. Now, our levels, however, we should mention, are actually 56% of what we saw during our all-time peak. So this was set last winter. You can compare these two peaks here. 56% is where we're sitting in comparison to that large peak. Now let's take a look at hospitalizations tonight. Those are sitting at just under 2,000 patients. And so that is actually about 50% of our peak patient load that we saw during last winter's surge. So essentially, if you compare the rates, that is indicating that fewer people this time around are getting sick enough to go to the hospital. Here's infectious disease Dr. David Priest with a potential reason.
We're going to have a lot of cases next 6 or 8 weeks, a lot of cases. I think for vaccinated people, a lot of those are going to be breakthrough cases that are mild, that do not require hospitalization or have complications. And thankfully they were vaccinated and it kept them from having something more serious happen. I think there'll be other people who are unvaccinated or haven't had COVID at all or haven't had either that are going to be vulnerable.
And so it's for these unvaccinated people that doctors have the most concern. Checking in with the vaccination rates in North Carolina right now, we are seeing 62% of the eligible population in North Carolina is fully vaccinated. So that's folks 5 and up. And also one of the most vulnerable age groups. So that's those 65 and older. They're 91% vaccinated. But keep this in mind, too. Dr. Priest says even though hospitalization rates here this time around could be lower, Omicron does have the potential to cause many more cases because it is more contagious. And so that in turn could still translate into a high number of patients.